Is Finasteride turning monkey into depressed limp banana disaster with shrunken jungle equipment? Internet forums explode with horror stories claiming this hair loss pill destroys masculinity forever, while doctors dismiss concerns as rare overreaction. Today, Monkey investigate controversial question. Are finasteride side effects real nightmare or fear-mongering propaganda? Truth lies somewhere between internet panic and medical minimization. Finasteride controversy breakdown. Critics claim drug industry hiding devastating side effects to protect billion-dollar profits. Online support groups filled with desperate monkey reporting, persistent sexual dysfunction, brain fog, and depression lasting years after stopping treatment. But medical establishment points to clinical trials showing only 2 to 4% side effect rate, with most issues reversible within weeks of discontinuation. Same data, completely different interpretations, creating information warfare in jungle. Adding fuel to fire. Some monkey develop post-finasteride syndrome with symptoms persisting long after stopping medication, condition not officially recognized by regulatory agencies, making patients feel gaslit by medical system that prescribe the drug. Most controversial aspect, younger monkey often hit hardest by side effects, yet they're also most motivated to prevent hair loss. Risk-benefit calculation becomes emotional battlefield between future baldness fear and present quality of life concerns. Real side effects data without marketing spin. Clinical trials with 3,040 monkey over 5 years showed 3.8% experienced decreased libido, 2.1% had erectile dysfunction, 1.2% reported ejaculation problems. Sounds low until you realize that's 38 out of every 1,000 users affected. But studies exclude monkey with pre-existing conditions, depression, or other medications that might interact. Real-world usage includes stressed monkey with complex health situations, potentially higher side effect rates than controlled laboratory conditions. Timing matters critically. Side effects most common in first 3 months as body adjusts to hormonal changes. Many resolve spontaneously as monkey biology adapts to new DHT levels, but some persist or worsen over time, creating individual unpredictability. Age factor significant. Monkey under 25 report higher side effect rates, possibly because natural hormone levels still stabilizing. Older monkey with already declining testosterone may notice less dramatic changes. Finasteride versus natural DHT blocking alternatives. Saw Palmetto showed 38% hair improvement in clinical studies without sexual side effects reported. Weaker DHT blocking 20 to 30% versus 70% with finasteride, but gentler approach for cautious monkey. Pumpkin seed oil blocks DHT producing enzyme with bonus prostate health benefits. Korean study showed 40% hair increase after 6 months with 0 sexual dysfunction reports. Natural doesn't always mean ineffective. Nettle root extract, green tea, EGCG, and beta-sitosterol provide mild DHT blocking through different pathways. Combination approach may achieve meaningful results without pharmaceutical intervention and associated risks. Lifestyle modifications like stress reduction, adequate sleep, and zinc supplementation can lower DHT naturally. Not dramatic like finasteride, but supports overall hormonal balance without medication dependency. Where finasteride wins despite side effect concerns, proven track record. 20+ years of clinical data with millions of prescriptions written. Most effective oral DHT blocker available with 83% of monkey maintaining hair after 2 years. Reversibility factor often overlooked. 95% plus of side effects resolve within weeks to months of discontinuation for majority of users. Permanent damage extremely rare despite internet horror stories suggesting otherwise. Cost effectiveness compared to hair transplants or lifetime topical treatments. Generic finasteride costs $10 to $30 monthly versus thousands for surgical options or hundreds for premium natural supplements. Convenience of once daily pill versus complex natural protocols requiring multiple supplements, topical applications, and lifestyle modifications. Simple solution appeals to busy monkey with limited time for elaborate routines. Smart approach to finasteride decision making. Start with comprehensive blood work, including testosterone, DHT, thyroid function, and vitamin levels. Establish baseline to monitor changes and identify other factors affecting energy and mood. Try natural alternatives first for 6 months if hair loss early stage. Saw palmetto, pumpkin seed oil, and lifestyle optimization may provide sufficient DHT reduction without pharmaceutical risk. If choosing finasteride, start with lowest effective dose, 0.25 milligrams daily, and monitor response. Some monkey achieve good results with quarter doses, reducing side effect probability while maintaining efficacy. Consider topical finasteride as middle ground. Targets scalp DHT directly with potentially lower systemic absorption. Custom compounding pharmacies can create personalized concentrations for individual tolerance levels. Red flags suggesting finasteride, not right choice. Pre-existing depression, anxiety, or sexual dysfunction, increased risk of medication exacerbating existing problems. Young monkey under 21 should explore natural options first, as hormone system still developing. Multiple medications or health conditions create low interaction risks not captured in clinical trials. Monkey with complex medical situations need careful physician supervision and gradual introduction protocols. Perfectionist personality types may obsess over minor side effects and create psychological symptoms through hypervigilance, sometimes fear of side effects worse than actual medication effects. Family history of depression or hormonal disorders may indicate genetic susceptibility to finasteride-induced mood changes. Individual risk assessment crucial before starting treatment. HairBuddy app approach to personalized finasteride decisions. Algorithm considers your age, hair loss stage, family history, and risk tolerance to recommend individualized treatment timeline and monitoring protocol. Tracks subtle changes in energy, mood, and sexual function alongside hair progress photos. Early warning system for developing side effects before they become problematic or permanent. Connects you with other monkey having similar demographics and response patterns. Provides gradual escalation pathway. Natural methods first. Topical finasteride second. Oral finasteride third. Stronger alternatives fourth. Systematic approach prevents rushing into unnecessarily aggressive treatment. Final verdict on finasteride controversy. Side effects real but not universal. Affects minority of users with individual variation in severity and duration. Most resolve after discontinuation, but some monkey experience persistent problems requiring medical attention. Alternative approaches exist with different risk-benefit profiles. Natural DHT blockers, topical applications, and lifestyle modifications offer gentler options for risk-averse monkey or those in early hair loss stages. Quick recap, finasteride side effects affect 2 to 4% in studies, but real-world rates may be higher. Sexual dysfunction, depression, and brain fog, most common concerns. Natural alternatives like saw palmetto provide gentler DHT blocking with lower side effect risk. Topical finasteride offers middle ground approach. Start conservative, monitor closely, have exit strategy ready. Smart Monkey uses HairBuddy app for personalized risk assessment and gradual treatment escalation based on individual response patterns. Your genetics, your timeline, your informed decision, not internet fear or medical dismissal.